Good afternoon, everybody. We are into our second webinar for technical series, we can call it. We once again have our my very good friend and fantastic speaker, I'll say orator as well. Today she is going to talk on digital communications in diagnostics, which means be it an email or a WhatsApp or an SMS, how are we supposed to communicate? And no best person. Dr. Santvana Verenekar is basically, founder and chief trainer, definitely once she's a founder of her baby, that's Q-Team. She has done multiple sessions of training. I will call her as a very on ground trainer with me in Kaho for various Kaho programs. And I think the best part about her is she comes down to the level of the audience and actually holds hand and trains them. So I think over to you, Santvana. I'm looking forward for this fantastic session and many more to come from you. All the best.
Thank you so much, Dr. Aparna, and welcome to the audiences, the attendees, and to the panelists over here. Our today's session is going to be on the digital communication in the diagnostic industry. If the attendees have attended the previous session, which I have discussed only on the communications, which also included the verbal communication and the other modes of communication, the written communication, the do's and don'ts of communication. Today, we are going to focus basically on the digital communication, the various methods of digital communications, the do's and don'ts of digital communication, and how can we overcome the apprehensions that we have got when it comes to communicating on the digital media or the platform. So welcome to you all. So dear friends, this is my presentation for the day, and I would like to speak to you all on the various modes of digital communication in laboratories and in diagnostic centers. Now, as all of us are aware, communication basically means exchanging of information, imparting, exchanging. It can be either in the form of speaking, it can be in the form of writing, or it can be in the form of expression. So how are you communicating and what you're communicating is a very important part of your daily life in your, I would say, in your personal as well as in your professional life. Now, when it comes to digital communication, we have to be very specific that it refers to the use of devices, okay, to send the information electronically. So all of us have been connected to each other, especially during this COVID times, wherein this was the only media to communicate and to present our whatever information that we wanted to send across to the party in front. Now, with the advent of the digital communication came a new set of rules to guide the social interactions through the technology have come in. And these rules have been collectively referred as the netiquette, the etiquette of dealing on the net. The modes of digital communication, it can, if we are talking in terms of when I talk about the hospitals as well. So it's when you're talking about the patient safety and the well-being of the patients as well as the employees, it can be either the intra-hospital or the intra-hospital. So when it comes to the diagnostic centers, it can be inter-diagnostic center, that is within the organization, or intra-organization. There are many types of digital communication, but commonly referred to as in the digital communication channels that we use have emails, have phone calls, have video conferencing, and the instanted messages like the short message services, the SMS, the web chats, WhatsApp, then even Telegram. Okay, even the blogs and the podcast. Even Kaho has recently started with podcast. So these podcasts are also considered as form of digital communication. Now, it is very important that whenever you're talking about a digital communication, your intent of spreading that particular message has to be very clear. Okay, rather than lingering around a topic, if you focus directly on the subject, it becomes easy for the person to understand. And as we all are aware, most of the organization today, they have got the online channels, okay, whether it has been with their customers, with their employees, or with their stakeholders. I would say that 90% of the things are nowadays done through the cell phones. So whenever you are going to have any form of a digital communication, you should particularly see to it that whether it is a text, whether it is a media, or whether it's a video, what is going to the person in front, whether it's in a group or it is on a personal level, it should be authenticated before sending it. Now, the techniques for proper communication on the cell phones are the SMS, WhatsApp, and Telegram. There are other ways also, but they are not considered because they are all social media. So we would not talk about Instagram or Snapchats and all, because these are not for the communication and diagnostic industry. And for the proper communication techniques on the platforms like the computer or the laptops, we have the intranet, which is within the organization. Most of the bigger organizations, the corporate world, has the intranet facility, and otherwise the emails. Now, before I talk anything further on the do's and don'ts, I would just like to mention that whenever I've just spoken to you some time back saying that very specifically, there should be a point of focus whenever you are discussing anything on the digital media. Okay. Talking too much, writing too much, writing bigger notes, generally the main point of content is lost. So when most of us know that email is a facet of daily life today, most of us have got either our corporate email IDs or we have our Gmail IDs. Gmail also has its disadvantages, which I'll be discussing with you in the near future. But mobile technologies have become the dominant mode of access. Okay. And the only thing that we need to remember over here is, though it is coming with a convenience, it is also has the risk of privacy. There are, if your mobile phones are not encrypted, your messages are not encrypted, this can lead to the information being leaked out, which can be a big disaster for the organization or for the healthcare industry. Now, when I'm putting these points one by one. So encrypt your mobile and your phones. Now, this is very important because according to the Health Information Portability and the Accountability Act, the HIPAA, it has been observed that around 23% of data has been actually been removed or been stolen from the third parties. And these third parties use it because most of us have got the smartphones, and these smartphones generally tend to pull out the information. Now, all of us know that since we have this facility, many a times when you are checking a net or you're going through various other platforms, these information are stored somewhere in your cell phones or even on your laptops. What happens is these particular zones, they start pulling data from your smartphones. They have the methodology. They are very smart people. But the only thing is, when you're doing this thing, your precious data or the personal data of any patient, it may get leaked. And as I mentioned, in United States, around 65% of the emails were through the mobile devices, and these mobile devices were being taken and captured and pulled in for the data by the third parties. Now, whenever such informations are leaked out, you have a lot of legal issues that can take place. Okay. Now, cybersecurity, we may talk about everything. The bigger organizations do have a very specific, I know of a couple of where I have audited these laboratories and diagnostic centers, that they have a very special cybersecurity cell, which takes care that none of the reports are being leaked anywhere. But for the smaller laboratories and the medium-sized laboratories, I would request you all to be very, very careful whenever you're going to put in the information, either through the WhatsApp or SMS, or it is going to be your emails. Now, when we are talking about communication in the form of an email, even if you're going to send an email to a patient, just think first whether it is the right method of sending an email, whether the email is because as I told you that Gmail also has its own disadvantages. Most common form of sending emails are through Gmails or through Yahoo. the data can be pulled out. So it has to be very specific to the patient, confirmation for the patient, consent from the patient is very important. This one thing, please remember that you need to take a consent from the patient before sending an email, the report by email or the information by email. Now, one more thing that you need to remember is, if at all you are going to share the patient's report with the physician or with the doctor or the service provider, you need to take a consent even at that time. So a written consent or a consent by mail or by WhatsApp. WhatsApp generally is not considered something which is very good, and it should not be the mode of communication with patients. It can be only an internal, but not an external communication. But whenever you're doing this thing, you should ensure that these consent either in any form, whether it can be on your TRF, you can take it that yes, generally there is a tick mark column. So the moment they have tick marked it or signed over there, then that means they approve to it, and they approve to sharing the report with their physicians. Now, though when we are talking about an emailing a patient, it is important to consider what the audience, the method of communication or the mode of communication. Talking very high-tech language to the patient, he or she may not understand. Most of the bigger laboratories I have seen, they generally send the report with just a one-liner. You're requested to open this mail. This is your this is the ID and this is the password. The password generally is given as the telephone number of the person who has whichever was given during the time of registration. This method is easy because this cannot be opened by anyone else other than the person who has given the number. So you should actually focus on all these kind of very, very small little things which take care of that the data is not leaked or exposed. Now, whenever you are talking about, I would say this is when we are talking about an external. When it comes to internal communication and email, this is a big challenge. I have seen mailers after mailers. I also own an organization. I'm a part of many organizations. And what is observed is, whenever you are sending an email, you have to be clear on certain points. Number one, the subject should be short, precise, and what exactly does it want to communicate. For example, if I start writing a message like reference to a meeting on so-and-so regarding your investigation on so-and-so, that is a big, big, big subject. No one would be interested. If I say, suppose it's a pap smear. Okay, you can just put pap smear / patient name or your organization name, and then you can start writing to the patient. So when that subject pops up in the window, the person who is going to receive it knows that what specific it is to. The specific message is the content of the messages. Now, second thing is your salutations. You know, many of people, they just start writing it or replying to a mail without even acknowledging the person who has sent the mail. So your salutations with dear so-and-so or whatever it is. If it is with a colleague also, please, whenever it's an email, it has to be an official way of communication. With, I'll show you an example of, even with my colleague who's the advisor to an organization, how do I send a message? It's very clear, though I have discussed, but whenever I'm sending, the subject is offer letter to Vikas, example. Okay, and to the person, dear so-and-so sir, greetings from Q team. So though I have just spoken to him and I may have said 100 times good morning, good afternoon, good evening to this gentleman, but still I will always write greetings from Q team, and then a very small short line saying that please find attached the offer letter for so-and-so with the JD, please suggest your views. If I start writing a too big a mail that this has reference to our discussion and I had discussed with so-and-so and he has replied so-and-so, and then we have discussed on the JD, and then now I'm sending you the details. So now you please look at it. Please tell me what is right and what is wrong and what to add and what to delete. This becomes too long an email, and people do not like to read for a very long time. So the shorter the message and precise the message without any ambiguity, it would help with conveying the right message at the right time to the right person in the right manner. Also, whenever there is a sensitive or a complex issue, I would always suggest that first you have a face-to-face dialogue. A face-to-face dialogue, if it is not possible in person, at least through a mode like Zoom or, for example, a video call, wherein you can understand the expressions of a patient, a person, whether it's a patient or it's a colleague. I'll give you a very good example. Is like I was traveling for the Kaho GC committee meet, and I received a message while I was in the meeting, and I did not want to get disturbed. And there was a question from someone who asked, "Are you coming today for so and so work?" And the only thing I could write is no, because I could not reach there. And then I went back to the session and I was attending the session. Later on, I received a very, very negative kind of a attitude from that gentleman, saying that your message was very rude. You just wrote no, because neither has the person seen in what situation I am, or what was the expressions when I was writing this. Now, just a simple no can create a lot of misunderstandings amongst your people, amongst the colleagues, or whether it's a patient or something. I have few messages. I receive a lot of messages from even people who have got complaints against organizations. So in one of the such messages, the person from the team has written very, very strange messages to the patient, saying that we cannot give you the service. We don't know anything. You have not cleared it. Means something where the communication was pointing fingers at the patient in front rather than getting the problem resolved. This matter has been escalated to a level wherein now it has gone actually to the court of law, saying that there was a breach of contract, and how come so many people were involved into it, and how did the legal team from the organization also get involved into it when the patient was not aware of it. So you have to be very careful whenever you are sending any kind of a WhatsApp or an SMS to the people who are involved. Now, one more spam. And when you have groups, I have around 116 groups. Now, when it comes to such 116 groups, there are so many spams that take place, and all these spams. I'll give you an example that someone has wished today, 3rd December, is my Subhashji's birthday. He would have been 84 today. What do you understand? He would have been 84 today. That means this gentleman is not there anymore. He has left for the heavenly abode. And the person is written like, I'm doing a small havan. And on the same, just after that, taking that into consideration, there is someone else who's writing, happy birthday, dear Subhashji, on your 84th birthday. And may Lord so-and-so shower his blessings on you for a healthy and wonderful future and prosperous life. Now, isn't this something which is strange? Many a times what happens is people get there are so many spams that come, and people get so involved into just replying without seeing the content. Is that when disasters start taking place, and there's a lot of miscommunications that take place. So please be very careful whenever you are sending. Avoid sending in the groups, in the official groups of your organization, any message which is a spam. Many messages that even come to me from some other organization, it may be related to, for example, I would say it may be related to the diagnostic, but it is going into say into an operations group. Now, operations group may not be interested in what is happening in a pathology department or in a diagnostic sessions. So at such places, there are always issues. So please be very careful on which group are you putting a message to. Now, whenever you are communicating on the digital platform, please mind the health literacy gap. Okay, people over there are not literate enough to understand the ambiguous language that you talk, the high-tech language. So patients would require education to make it meaningful to their health. Now, most of the times, whenever these people are coming to you and they request for the reports, either on the electronic media or on the mobile phones, or on the emails, you need to please explain it to them very well, that we would be sending you an email. It would be with an ID and password. The ID will be this and the password would be this, so that he or she is well aware, because not everyone is that educated, especially I would say the geriatrics also have an issue, and people in the tier 2 and the tier 3 cities also face a lot of difficulties when it comes to accessing their data. Now, when it comes to electronic communication, you should actually, these should have the potential to improve the health and healthcare status of the patient. So whenever you are putting an information, ensure that it goes to the right person. At the same time, it is something which can be easily openable. It should not happen like how our bank accounts, they have got so many things. You have to put in your first 4 these codes and 5 these codes, and then the last 3 codes of your account number. So no one has a time to go through searching that what is the first 4 numbers over here and the second 4 numbers and the third 4 numbers. Make it as simple as possible for them to get information on what they have, because they have paid for it, they want to send it. So maybe they want to forward it to someone. It should be easy for them to disseminate. If you encourage the use, whether it is in-house or it is for the patients, then you should explain them the risk as well. So if, as I told you about the informed consent, it should be a standard practice. I would actually, on this forum, I would like to thank one of my very, very close friends and an advisor to a company who has also been a client in the past. He had given me some really, when I was discussing about healthcare communications, he really put up very, very good points to me, and that has actually helped us with putting up better points for this show, which we are having today. So whenever you are, especially he had focused more on the informed consent. So before you are going to have any kind of an information given, please ensure that you have the informed consent. I'm repeatedly, because this can be a legal matter for any organization, even if it's a smaller lab. We cannot consider that we will not have problems in future. Now, whenever it comes to, as I told you about Gmail, Gmail has a lot of healthcare information that can be leaked to third parties. So when your organization is sending through Gmails, please ensure that it has to be a very, very secure and safe way of. A very easy methodology for people who are from the tier 2 and tier 3 cities is that you can call a computer expert, a software expert, and ask them to get your Google linked in such a way that third-party intervention can be minimized or actually nullified. It's a very easy method. I have done it for my Gmail account through a software person, so you all can get it done as well. Now, what are the positive impacts of digital communication? So when we talk about the various methodologies, we have discussed about it. Now, what are the good things that can take place? Number one is there are no barriers. Okay. It is very fast, easy way of communication. It helps you in delivering the report or delivering the message, delivering the information on time to the people who are available at that particular, at any distance. I can send an information from here to my colleague who is in UAE, he's in Dubai. And for a project which is going over there, if he needs any help, he can contact to me immediately and I can send him the details. So I don't have to wait for a telephone call or for an email and replying to the email. So mobiles are one of the best source. It helps in strengthen the relationships. Okay. When you're putting up information, okay, and especially this is for the closed groups in an organization, I see that many a times the information which is sent across, it helps to build up a sense of oneness in the organization. All the technicians, the people who are involved, the doctors, the pathologists, all of them feel that yes, they are considered as a part of the organization, as a stakeholders of the organization, and the organization wishes to share information with them. So this helps, and everybody is actually on the same line. So when you are on the same line, yes, your relationship becomes much, much better. Rather than me giving an information 1:1 only to Dr. Aparna, if I put it up in a group wherein Dr. Aparna or Kaho, the entire team is there, then all of them know. And if anybody has any confusion or any clarification, they can put it up. So our strength is our relations are so strong that we all are on the same page. Kaho people are all on the same page. So that is how each and every organization or a laboratory should work. Better solutions. Technology has brought the world closer, and we can promote exchange of thoughts to find better solution to problems. So rather than waiting for an issue to get escalated to a very high level, it can be taken care at the minimal level or the lowermost level. Services like video conferencing has made it possible to give best education to students, to technicians, and expert faculties are all available. So these e-schools, now I would through this media today, I would request that all people who are attending the session today, you all should start off with giving information, sharing information, and also at the same time, as much as possible, have good mentors or good faculty who can train your people at a 1:1 level. For example, there is a laboratory, say in Nasik, who has got around 7 technicians, and there are 2 pathologists and 1 microbiologist and all. If they connect to Dr. Aparna and they say that, okay, fine, we all want to have a small session with you wherein you can explain to us what are the best methods or ways of maintaining quality in our organization. All of us come closer. Everyone is on the same page. Everyone starts doing the same thing again. Rather than sending one person to a conference and that person only learns something and only 10 or 15% of that information is passed on to the rest of the people. So have the e-schools, have the e-conferencings. Impact on relationships. No one would say I disagree. Okay, if I say that technology is a rationale behind the success of a long distance relationship. Now, when you are communicating, you are meeting people, you are talking to people, it is a 1:1. But when you are on live, like how I'm communicating with you, at least the relationship that we have built up over a period of time remains. You can connect on the other programs that we are attending. There could be other good speakers, much better than me. So this relationship with Kaho and you people who all are there, it will remain as a lifelong relationship till the time these sessions continue. So there is a very positive impact, unless it is something which creates a big ambiguity and many of the pitholes or pitfalls in the way of communication. And development, of course, video conferencing is the best form of development, and it helps in faster decision making. It helps in promoting the activities. It also takes care of your business statistics, all these things, and it helps for your communication. The negative impact. So when we talk about negative impact, it is all based on the perseverance of the person who is actually reading the message. As I told you some time back about the example that I have given, understanding is a big thing till the time, and I cannot expect everyone to be like me, thinking that, okay, fine, you really don't know what circumstances or what situation the person is in, so we will discuss it at some other time. Most of the issues, especially in the organizational groups, get escalated to a level where it is very difficult to handle it, only because since you cannot see the person and you cannot understand, then at such times you tend to assume a lot of things on your own, and there is a big gap between what is being conveyed and what is being perceived. The effect on the nonverbal communication is also, since there is a lack of face-to-face interaction, the nonverbal grasping power of individuals is not good. Not everyone is on the same platform or the same page. It has a lot of reduced social interactions. I cannot talk about the current COVID times wherein we all have our restrictions, but once this is gone, if the same attitude is going to remain, the same kind of a trend is going to remain of communication only on the digital media, your social interactions, the interactions wherein you can actually speak to people, convey to people, meet people, and express yourself, that would be reduced. So that is one of the negative impacts of having the digital way of communication. And yes, it leads to a lot of addictions. Sometimes people say that they find me a very difficult person when I go to an organization and I do not allow people to use mobile phones inside their offices, except for communicating on through the organization provided mobile. So I have seen in many hospitals or in laboratories that people have this tendency of either scrolling through all their in Instagram and Facebooks and sending Snapchat messages and many things. So this is basically one of the deterrent to the focus on the work, and this leads to a lot of reduction of the work compatibility of this person. And of course, when such messages come on cell phones and all, there are many messages which are negative, which creates a lot of anxiety in the person. And these technicians, or whether it can be a technician, doctor, anybody, they tend to remove this anxiety in some or the other form during the work hours. So I generally request and I always advise that people should not have cell phones at workplace or at the work desk. It may be at the workplace, but not at the work desk, because it interferes with the good working pattern. Now, some points that needs to be noted when you are communicating in a common group. Whenever you are adding emojis, please proceed with caution. These faces like which I have put right now, it should be avoided, because it does not send a very good message to the person in front. Whereas something like when you're putting a thumbs up, or you are pointing out that some message which is above and it refers to this message, these kind of emojis can be presented. Most of the time, there are a lot of problems with typo errors, the autocorrect. So please be sure before you are sending, rather than getting it deleted later on. So like hello dead, and since R and D are very, very close, it tends to go as hello dead. There are many words like this which have a totally different meaning on what you have to present. Emotional proofreading of the messages are very important. Like example, I'm saying on a message to Dr. Aparna in a group, and I say, let's talk. So let's talk is like, it appears as if like I am more with my own mindset, and I want to portray what I need to put across to her. And I'm not interested in listening to what she wants to say. So rather than this, if you put that these are good suggestions, and let's discuss how to work them and get them into a draft. This helps. Dr. Aparna would herself also feel very comfortable saying that, yes, Santwana is ready to take information from me, and together we can put it up. So there will be no anxiety amongst the two people, the sender and the receiver. Now, punctuation marks also add on a lot of information and value to the message which is being sent. Here right now, what I've put is an OK dot in inverted commas. The dot after an OK suggests it to be more negative rather than just putting an OK. There are many times where I've seen that people write short forms in group messages like Y for yes. Y can also be WHY. Okay. OK instead of OK or OKAY, they write only K. K is it's very difficult to perceive, to understand. So let us not have such shortcuts and short forms, but put it up in a very proper manner whenever you're communicating in a common group. So before I end this, I would just like to say that, number one, whenever you are communicating in the digital form, now first to the patient, please be sure, explain to the patient, talk to the patient, tell him what can you deliver. That is very important, that what are the deliverables. Once he or she understands the deliverables, then only please go ahead with any form of digital communication with the patient. Number two, when it comes to within the organization, if you have your WhatsApp groups or your Telegram groups, please look into the contents of the groups before posting it. Please be specific. Avoid spams, avoid forwards, avoid any kind of greetings, because it only adds information to the group, but people tend to overlook it, and important messages in the group would just get missed out. So please be specific over there. Number fourth is, please avoid using emojis and shortcuts. Very specific information should be generated. Do not mistake or misunderstand any information that is being given. It is always better, rather than writing or creating issue on the group, if you can communicate 1:1 on the direct message with the person. For example, if I today in the morning we were having some discussion on the group, and I wanted on a particular topic only where I could discuss with Dr. Aparna. So I just selected that and reply in private or reply in direct message. I sent her a message saying that, can you please explain what does this mean? So that there is no kind of, I would say, discouraging the person in front or humiliating a person in the group, or humiliating yourself, because it is something which is very clear, but you have not been able to understand. So you would look like a moron. So don't let such things happen. So these things should be clear when it comes to emails. Please be very specific with writing the content, the subject, the salutations, the greetings, a very short information. If you are sharing any kind of you're replying to an email, make it a point-to-point reply. Say, like, select one point, say point 1. If, for example, I would say someone has written a mail to me in which they have put in 5 points. This project, the documentation on so and so is pending. So I will just select that documentation, and I will put an answer below that. These documents have been completed. These documents have been submitted. So that once they can review it, they understand that yes, things are complete from your end or from the sender's end. Third thing is that do not try to put everything in bold or in capitals. Bolds and capitals are generally put either to send the urgency, or at the same time, if you are writing too many of capitals and all, it shows that you are more dominating and you are pushing a person or the sender towards the information that you want to generate. So as far as possible, keep less of bolds and keep less of capitals in your in your communications. Keep your text, which is a standard draft, okay, which generally, like, what I use is Garamount, and I use the small size. Earlier I used to use the large size font. The large size font used to look, the moment a person opens an email, it used to look as if like Santwana is just bouncing out of the window. So when I once saw it, I realized that this is something which is not right. So let it be a small. Unless you want to highlight on a particular point, you can put as large. So these are the points that you should remember. So dear friends, this is on communications, and thank you so much for giving me this opportunity. And
I have a question.
yes,
do we have, I'm sure there is a clause on section 5 in NABL for digital authorization. Okay. Have you come across some hospitals where they have everything digital in the terms of, I understand the reports, but suppose we want to include all this into our quality systems, which is the basis of healthcare and Kaho. So have you, number one, heard somebody asking you that when you move around the country? And number two is there something like this in NABL or NABH standard? Or if not, are you aware that it's coming up?
Yeah. So, Dr. Aparna, this is a very, very controversial topic as of now, because during the COVID times, a lot of things have changed. Though it may have not been edited or updated in the NABL and NABH chapters, but digital signature, if it is being, the policy has to be made on the same, and the policy needs to present that who are authorized to do a digital signature or communicate in a digital format, or whether it is the SOPs or any of the documentations which are being presented. These has to be first in the policy with a from the management of the organization, and approval to be given to these people after confirming their credentialings. So once the credentials are confirmed, then only they have the privilege of having the digital way of signing or authorizing the reports, ma'am.
Okay. Yeah, I get it. What I was also looking at, when we have internal communications in the labs, by that I meant that there are SOPs and work desk instructions which are now going digital in more and more corporate labs. Okay. Can you tell me, I have seen one of the case. I mean, it has turned into a medical legal kind of a, like you mentioned in one of your presentation, that you said, okay, not possible since you were traveling to GC meeting. So it takes a very bad shape because person doesn't know that what you are into. So in that case, what do you think? Should we reply, or we just call up the person? Let me tell you what I think. I feel when I'm traveling, bad network, it's better not to reply. It's just better to make a verbal communication when it's possible. But what do you think you should do, since you have covered it so nicely?
Ma'am, I do agree 100% with what you say. And it depends, since I did not receive, for example, when we are talking about this, no, I did
Yeah,
not receive any information back. I perceived that, okay, the person in front has understood till I actually met the person 1:1.
yeah,
And that's when this came from that person.
yeah.
So either it is whenever you are communicating, let it be a total conversation, a communication, but rather than giving explanation on the digital media, it is always better to just pick up the phone, talk to the person, and just inform the person that right now I'm slightly tied up, I'm in so and so, and
Yeah.
if it possible, let us communicate, or send a message that can I communicate with you after at so and so time or after so and so hours. That helps a person to actually cool down, because uh, a lot during, especially during this COVID times, people have been very, very anxious on small little things. They have become very touchy, or they have become very sensitive to a lot of information that they are getting. So let us be very specific whenever we are giving an information. Be concise, be precise. Let's not be ambiguous. That's how it helps in a better relationship and communication.
So friends, fantastic session, and I'm loving the way it's going ahead. The moral of the story for me is, if you have time, draft it properly and be very specific. Just do not use emojis. That's not for us if we do not understand the updated emojis. If you don't have time, just don't write something which you don't mean. It's better to just say, can I get back to you? And then maybe have a verbal communication, at least intimate the person. I think it's a fantastic take home message, particularly, and I think COVID is here to stay. So we really need to know the SOPs of digital communication. Thank you, Santwana.